Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. My guest today is Dr. Eric Dinkins. He talks all about motion guidance and visual stimulation to allow you to improve from a multitude of injuries with a special emphasis on concussion and brain trauma. Hey everybody, Dr. Rob here, Proven Health Alternatives. We've got a great guest, Dr. Eric Dinkins, and I'm excited to share a lot of things that he does, and more so than what he does, I want to talk about the motion guidance, which I use in my office with many of my patients, especially my proprioceptive deficit patients and my concussion patients. So, Dr. Dinkins, let's do it. Eric and I'm Rob. How you doing today?
I'm doing fantastic, Rob. Thank you for having me on today.
Oh, I'm excited. Sorry, I was actually a bad boy. I got stuck at another venture, and I was the late guy for the first time in about 6 weeks. Nevertheless, Eric is a PT, MSPT, OCS, Cert MT, CMP, MCTA, CCI. Eric is part ownership of the team of Motion Guidance, LLC, which is a rehabilitation company with the primary interest in affordable visual feedback products. You are a physical therapist. You graduated from the University of Colorado. You have a physical therapy degree, and you've been practicing since 2001. I feel that, man. I was 1999. So you got some experience cooking. He is board certified in orthopedics through the American Physical Therapy Association and has a postgraduate diploma in manipulative therapy. You got an extensive background in sports medicine, and you've worked with many different physicians in the Steadman Hawkins Clinic in Denver. You've treated many athletes from youth to Olympic and professional levels. You used to teach for the Mulligan's Concept, which is very, very interesting. And you live in Castle Rock, Colorado. And when you're not traveling or practicing, you enjoy spending time with your family, mountain biking, and you play the guitar.
Casually, but yes. Yeah.
That's great. Thanks for being here. I'm so happy to share with you. So what's motion guidance?
Sure. Yeah, let's start there. So Motion Guidance is a visual feedback product, is our main kind of flagship type of product that we have that allows people to put immediate visual feedback on any body part for gaining awareness, giving the lack of visual feedback that most clinics don't have to their patients, and we do it in a cost-effective manner.
So why would we want this feedback? I mean,
Sure.
Tell all our listeners, we've got some consumers, we've got docs. Why would we want this?
Sure. Well, actually, the genesis of Motion Guidance was based on need. So I was working with a resident in my clinic, and we were doing knee squat retraining for the ACL population at that time. And the comment was made, what was really help is if we stop touching these people and just telling them what to do, but actually show them where their deficits are. And so that kind of started the progress of development of the product, which allowed us to put a laser pointer fixed onto a ball and socket mount onto the thigh, and we projected it onto the floor. And that allowed people to actually see what their hip knee angle was doing during their squat. And that has now developed into head cradles and armbands and ways to put it on the torso and the ankle. And it really fills the need of how we typically treat, which is kinesthetic awareness by touching people and saying, hey, here's this. And then we, of course, give a lot of auditory instructions. But the vast majority of people for motor learning require some sort of, or they prefer visual feedback for gaining skills.
It's interesting because I think the visual feedback is really taking the world by storm. So let's talk about some of the systems that they're working in and what the ability to get that feedback does in a proprioceptive light.
Sure. Well, there's definitely a couple key areas in the body that we've keyed in on in the research that show us that there's obvious deficits in joint position sense or proprioceptive conditions. And those include the head neck for conditions such as whiplash, concussion, and neck pain. We have low back pain. It's pretty well established that there's joint position sense deficits with chronic back pain. At the knee during proprioceptive deficits for things like ACL injury, and then of course at the shoulder, the strongest literature suggests after dislocation or with chronic shoulder pain.
So you're using it for treatment and assessment, correct?
Oh, that's a great statement there, Dr. Rob. So that's the key actually with the products is you can use it for both, for assessing if they have these deficits based on literature, and then using it for the treatment.
Great. So they're using their visual acuity, and you're using a light on a laser, which I'm sure you'll probably show a little video of how it works. We'll add a
Of
little video.
course. Yep. Mm-hmm.
And so you're doing the visual acuity to help with, again, with the feedback. You know, it's so funny. We both spend so much time in front of other practitioners and patients that sometimes the practitioners forget that 4 out of the 12 of the cranial nerves are directly, the whole purpose is just the eyes. And it's really like 6 out of 12. And athletes, like you were referring to, 40 to 90% on their scale always have some sort of gaze stability or visual disturbances. So it's a great concept. That's why I use it in my office and I recommend it. Because you're getting that visual acuity. My question is, when you've done it with the eyes, and then obviously because it's a laser, they have closed their eyes, have you seen eyes closed from eyes open improvement?
Yes. So essentially there's carryover. The whole point really is to give people awareness of what they're doing, but then it needs to become fully compensated from their decompensated state. So we eventually want to take that visual feedback away and have them rely on just environmental recognition. So you can see these in real time actually in your office with our device of seeing a decompensated state or a deficit, whether that's joint position sense or ocular motor like you're mentioning. And then with the training, and we put out tutorial videos on our website, and we might even have some of those kind of linked into this podcast. You'll see these changes happen, and that's the whole point, is you can see them happen in your facility right in front of you.
Yeah, I mean, what's great is you see it before your eyes, no pun intended. So
Right.
you mentioned some conditions. Let's specify. Let's talk about concussion, because concussion
Sure.
is taking the world by storm. People seem to be really lost on how to treat it. So let's talk about how motion guidance fits in with the concussion protocol and how it's going to expedite clinical outcomes with concussion.
Sure. Well, typically I think the literature agrees right now that there's 3 main domains that we're trying to link into the concussion as an overwhelming umbrella. So we have to deal with sleep and regulate sleep. We have to deal with subthreshold cardiovascular activity and get people moving fairly quickly, which is opposite of like a decade ago, which was, still rest them and, don't do anything for a while. And then we have the rehabilitation piece, which is going to be focused on the vestibular and the ocular motor, screening of sorts. And so one thing that people get a little bit of a challenge with, especially from a patient standpoint, is we tell them that they have these deficits, and it's hard for them to understand that they have them because they can't see them. So things like joint position sense air, where people are turning their head with their eyes open and eyes closed and think they're coming back to a very particular, what we call a standard deviation in our practices. They don't know if they have that because they can't see it. They think they're looking straight ahead, and yet they're looking tilted off. Well, just by simply putting a laser around their head, they can see if they're lining up, straight ahead during their testing. Think like things like saccadic movements. So thumbs out in front and my head stays still and goes back and forth. Well, is my head really staying still? People just trying to do the activity, they might get a small motor cheat and they don't know that they're cheating, but having a laser projected out in front of them will give the clinician and the patient easy feedback on whether they're actually moving side to side. Smooth pursuits is another thing that's common as a deficit in post-concussion syndrome. So being able to follow activities with your eyes and not move your head, same type of thing. Convergence is another thing that can be worked on with post-concussive syndrome. And then antisaccades is something that's been shown in the literature to be a deficit as well.
Yeah, that's great. So much has been done with the eyes, and I agree with you on sleep. Sleep is a critical element. It's probably the missing element in all our functional approaches. Unfortunately, it appears that women don't respond quite as well to concussion as men. There's a whole bunch of reasons for that, as we know,
Right.
but they don't sleep quite as well. I love how you said sub-threshold, steady state, and I think that's great. Not getting people's heart rate up too high, but more so, like you kind of alluded to, the head movement, where you can
Right.
get that symptomology, and everything's with the eyes. I tell people that if they want to test, they can go and get like a visual oculomotor screen and start testing some of the athletes with their eyes.
Yes, yes, of course. Yeah.
So you could apply that with your laser also, because you made that point very well. You're supposed to hold your head and eye in a specific position. And if you're moving your head to get your eyes to another spot, shows a deficit.
Exactly. And it's real easy to see. It shows up very, very clearly to both you and the patient. We feel that that's super important. Oftentimes people with prolonged symptoms after concussion, those 10 to 30% that get a concussion, but they have prolonged symptoms, they don't know what's wrong with them. They can't see that stuff. And sometimes it's more meaningful for them to be able to engage in, hey, you can see your deficit versus you're telling me I have something wrong with me, but I just don't feel well.
Well, let's go into ACL injury and some knee injuries. By the way, it's not a bad next step, because as we all know, with concussion, we have a 3 times increase of lower extremity injury, hip, knee, and ankle. So
Correct.
let's talk a little bit about hip. Let's talk a little bit about knee and how that proprioceptive feeds. So for me as a chiropractor, I tell all my brethren, if we don't do proprioceptive feed and rewire the brain and retrain the brain, we're not going to get the clinical outcome that's needed and what we want. So tag on a little bit with the hip and the knee.
Sure. Yeah. I think that's a perfect segue. That brain-body connection. If we're going to see a lower extremity deficit, we definitely need to be looking at, cranial nerve function. We definitely need to be looking at oculomotor function, and make sure that everything's right from a sensory input standpoint from the environment. But we know that for a long time now, when we have ACL disruption, we're definitely going to have some proprioceptive deficits or decompensations that we need to uptrain. And oftentimes just doing balance activities and strengthening is not enough. So as I mentioned before, with the genesis of motion guidance, we started putting a laser feedback device onto the thigh. We have some standards that we've created in our protocols that are on our website that we can also put some videos to. And we project those out on the floor. And what we're just trying to give people an awareness on is, as they're going through, let's say, a single leg or a double limb squat, how do they prefer to move, and can they control that movement? So unfortunately, for a long period of time, we've always thought that, valgus was the enemy. If you internally rotate your hip, then we want to avoid that. We do a lot of training in rehab sciences of external rotation and abduction at the hip. But dynamically, with angular velocities and with large people doing very quick movements, we need to be able to control that movement all the way through internal rotation as well as adduction at the hip. And if you don't know what's happening and when it's happening in different depths of squat, you may not train those areas appropriately. And giving visual feedback during those angles can be super beneficial for the patient as well as the trainer or the chiropractor or the physical therapist to be able to correct for those weaknesses and strength deficits in those areas.
Outstanding. So let's get to the big guy ankle sprain. One of the most common sports injuries, 80% recurrence. We all know proprioceptive. Tell us how you use motion guidance to help get over those numbers, and give some case studies on that if you'd like. Tell us what you've done with your patients, because I know you see patients.
Sure. Well, another nice segue from knee into ankle. So if you don't know what the kinetic chain is doing above the ankle and you're just treating the ankle, then you're going to have some reoccurrences. And like you said, the chronic ankle instability, the CAI, is really big in the literature, and actually growing every 5 years when we look at these types of population studies internationally. So it happens a lot. But just as simple as balance training is one thing, understanding what you're trying to do with your strategies is another. So putting the motion guidance on the lower limb to see how much rotational function we're getting on soft or uneven surfaces, putting it on the trunk to see how people are forward bending and leaning from the hip, can be a really big issue, as well as returning to functional deficits. So one thing that I found recently with one of my volleyball athletes, and she kept spraining her ankle. Not only did she have a distal fibular issue that we needed to address with some other techniques, but we found that every time she landed on one leg coming down from a jump, she would laterally trunk lean, and she had no idea that she was doing that on the involved side. And so putting the motion guidance on her chest and having her jump and land allowed her to actually see her trunk lean in real time. So the laser gave her a visual representation of what her body was doing. And then she was able to correct for that over time with different types of applications of exercise and training.
That's great because, again, I mentioned it's the number one recurrence injury. But you said trunk lean. So let's talk about that. So one of the biggest problems that we have is 80% of Americans at some point have lower back pain. And a trunk lean or a lumbar flexion versus a hip hinge causes a lot of straining at the spinal level, a lot of collagen tearing, ultimately leading to an early onset of damage at the joint and the disc level. So motion guidance, can you retrain or help somebody train a hip hinge versus flexion bending at the lumbar spine?
Oh gosh, it's actually super easy that I found in my practice. Of course, I'm biased, but we've even been using this for like Parkinson's disease. So people who just, they have that bradykinetic movement or they have faulty movement pattern with their hip hinge. If I have a laser on the front of a trunk for people and I say, I just need you to get that laser down between your feet before you start to rise up, or as you're going from a squat start to finish, it gives them an easy, reproducible visual feedback of their squat each and every time. So it has more meaning for them. So if we take a look at motor skill acquisition, we like to see in the literature at least external focus of attention, enhanced expectations, and then autonomy of support. So the last two that I mentioned end up being motivation. Is the person have meaning during what they're doing and they have a say in what's going on? Well, the laser provides all those factors right away for motor skill acquisition. It gives them that external focus rather than thinking about their own body. It gives them into, well, I'm just moving the laser, but it's still a representation of their body movement. And then the motivation comes from reproducing the same thing every single time.
Interesting. So let's take it to the next step for everybody listening, because everybody's always concerned about concussion. So they get a concussion, you can train, and it's a part and parcel of rehabbing a concussion. A lot of people also get their core shut off because damage or unsettling to the brain area. Your 3 pounds of your brain, which is the consistency of Jell-O, gets damaged and pulled from stress and shear pain. But I've noticed a lot of people post-concussion having a core. So the real question is, how easy is it for you to move your laser to different areas in a practitioner's office so you can do everything that you need in a short time?
Sure. Great question. It's actually super easy. So the design is a ball and socket joint. So the laser actually sits on 2 different style mounts. One's a perpendicular 90-degree mount, one's a flat mount. And then it just slides into a small cradle onto our different size belts. And in our clinician kit, we have 4 different size belts. The belts each have a barrier on there that's hypoallergenic that you can wipe off. And so instead of most setups where you put like a laser on a cap or something, every time you want to adjust the laser, you have to move the cradle around. In our device, you have to just spin the laser on the ball and socket joint until you feel like you've acquired the motion you have. So it's actually super comfortable for the person because you don't have to pull on them and keep adjusting things. You just have to make a small adjustment on the ball and socket. And then our different size belts allow you to actually customize where you want to put it for different size human beings.
Everybody who watches my social media has asked me 100 times about the poster in the back, because I do it in my rehab room, and that poster is exactly what you guys use in motion guidance. So we should call that out and let everybody know about that. I love what it does. Again, and I'm a big proponent. As we acclimate, we're realizing eye input, visual input is a critical element. Most of the problems that I've seen faulting in musculoskeletal, again, is the lack of rehab. So you and I hope you can cascade with me on this, that most people who go to a manual therapist, a physical therapist, a chiropractor, a naturopath, whatever they're going to for their manual health, they're going to look for somebody who incorporates some form of proprioceptive rehab. The motion guidance is a great choice. So what was your inspiration? I mean, we all have that moment. What was your inspiration for being a physical therapist and your inspiration for this motion guidance? I know you gave a little story, but there's that aha moment.
Well, definitely the aha moment was someone telling me they didn't get it. So trying to, work with people, doing those squats originally, like I mentioned earlier, and me saying, so I want you to feel that you're letting that knee drop in when you get past, when your hips drop below this particular level. And can you feel that? And they said, no. It's like, okay, well, if you can't feel it, then I need to come up with something else to do that. And it's too artificial to put your hand on somebody's knee and push it toward the outside, or wrap a resistive band around there and you're pulling it toward the outside. Those things do not happen in work. They don't happen in daily activities. They don't happen in sports. So that sort of artificial training often left the person lacking what they were supposed to do when they returned to their activity that they were having deficits in. And so giving them the ability to learn themselves, giving them the autonomy to say, well, if I need to change something, I'm given the necessary feedback to let me make the change, but also me give the skilled feedback as a practitioner to how to guide them through how they need to change their movement or their action. Just ends up being super powerful. So it was definitely the motivation was a failure on my part. Yeah.
On all our parts. And this is great. What's next in motion guidance?
So we got things coming out on the horizon. So we have some research studies that are going on, EMG based, as well as things linked to external focus of attention that I mentioned before. So hopefully those will be completed in 2020 and published late 2020 or 2021. We have on the horizon some are you familiar with Fathead, the vinyl things that you can put on the wall and move them around into different surfaces?
Yeah.
Well, we're actually going to be incorporating that sort of technology into our clinician kits, where people can, very easily find blank walls or doors or floors and actually move some of our flags, like you mentioned before, around, as well as being able to draw on them. So we have standardized some of our designs to fit the needs of most functional neurology, chiropractic, physical therapy practitioners. But people want some variation. Their patients will learn very quickly. So essentially we have a movable dry erase board coming up that has grid lines on them that you can also draw things on and say, well, I need to track this differently than what your flag provides. So we have that coming up in 2020. We also have some light up laser targets that we're working on that will give you a visual feedback for accuracy, as well as auditory coming up. So yeah, look for those products coming up in the future.
That's great. And by the way, my book's coming out in 2020, and in it we have the largest chapter is concussion, and we make reference to a laser pointer to increase visual proprioceptive input. That's exactly what we're talking about. So, you get an endorsement from me. I'll give you a little testimonial on the motion guidance, use it, lecture on it, all that stuff. So now that we talked about it, how can they learn more about motion guidance, and how can they get its applications?
Sure. Well, our website is motionguidance.com. So anybody can get on the website and find out more information. We have tutorials on there, links to a Vimeo set up via YouTube that you can see all of our videos that are linked to the product. We're pretty big on Facebook, Twitter, and Instagram, and starting to pilot some things on LinkedIn as well for videos that you can see there. All those are going to be hashtag motion guidance or at motion guidance. So there's no confusion there. Our product is designed to meet all the needs of a clinician from the get-go, for starting proprioceptive and body awareness training. And our whole clinician kit comes with multiple flags and targets, a green laser, which actually shows up much more brilliant to the eye than a red laser, but it still falls under FDA standards for brightness and power. So that's nice. Multiple mounts and belts that I mentioned before for all under $300. So you can find all that information on our website, and we find that people are just super happy with the price point, and it puts us a big distance away from more expensive devices that do some similar things.
Yeah, it's priced great so everybody can get it in their office. And you do have a lot of instructional videos and things like that because I've gone on them. You've been nice enough to share them with me. So that's great. I really appreciate all that you've done. Dr. Eric Dinkins, Motion Guidance. Got any parting shots?
I just appreciate the time and you having me on, Dr. Rob. You're doing fantastic things. So we appreciate you too.
I appreciate that. Dr. Rob Silverman, Proven Health Alternatives.